Welcome everyone to the update of COVID-19 situation. Today is Saturday, 20th April 2020. First of all, please subscribe to the tech channel, as I said earlier, so that I don't have to worry about YouTube sending. First of all, let's take the world. World has got almost 2.5 million cases and 168,000 deaths. USA has got 771,000 cases plus and 41,300 deaths, large number. New York State has got 247,000 cases and 18,200 deaths, and Texas has got 18,317 and 18,200 deaths. 450. New York has got 18,000. Yeah, Texas has got 18,317 cases and 453 deaths. Fort Bend, 799 cases and 18 deaths. Harris County has got 4,823 cases and 75 deaths. Government has started a three-phase plan to open up the USA. 4 states are easing up the lockdowns. Texas parks are open today, on Monday. Some shops will start opening this week. Florida beaches have already started seeing the visitors, so many. Is it too early? That's a question. Well, we'll see in a minute. Let's look at the Europe. Germany and Austria has got a large number early large number of testing back when the GP started testing, and then Angela Merkel took over the situation of COVID-19 and has done wonders in the leadership. She's doing 100,000 tests every single day. Yeah, those who are found positive, isolated. Those who are found positive, their contacts are traced and quarantined. All 16 provinces are working in unison. That's the important thing. Thanks to her. Spain, Italy, UK, Scandinavian countries have got all showing signs of smaller number of cases. That will certainly continue because of the lag period. Those who have come out very great in this situation, although lots of death though, South Korea, Singapore, and Taiwan. Very well done. African countries have just about started getting larger number of cases now. Well, these are all good reports and good figures. India and Pakistan, 17,650 cases and 559 deaths, and Pakistan 8,460 cases and 176 deaths. Well, I'll take these numbers as they are. I've tried to confirm it back home, talking to a number of people. They all say these numbers are correct. So let's hope they are correct, and let's hope that these numbers stay correct and that low. Issue with the India particular lockdown is that the farmers and agriculture workers needs to be eased out because it's time of harvesting, and the food security and nutrition is getting compromised. So I suppose they will agree on and depend on the herd immunity that will develop gradually. Food for thought. Should lockdown be eased out soon? Now here is the timeline that I can give you and some thoughts. On 21st January, first confirmed case of United States was there about 3 months ago. Now 771,000 cases. First death was reported in Washington State on 29th February, only about 50 days ago. Now 41,000 deaths in 90 days. So you can see that the control has really done its trick. Enforcing lockdown and the social distancing for about 8 weeks has created a great improvement. So if we do ease out, I think we need to really watch it very closely, and that's the only way. Howard University's T.H. Sun Public Health School has started talking about what could be the scenario in future, and I also saw a hard talk by Stephen Zucker on BBC yesterday, and he had Dr. David Navarro of WHO, who has worked on malaria, cholera, Ebola in the past, and I'll post this link if you want to watch that. He expects that the outbreak will keep on coming, smaller, larger, and it's a threat to all countries, constant threat of virus. Only ways to interrupt the transmission and spread, and that is by social distancing, masks, hygiene, learn to live with the virus probably for a long time. That's what Dr. Nabarro is saying. Action were not in unison in the beginning because different countries have started differently, and he thinks that action should be in unison. Everyone should be on the same page against the coronavirus. Basically, that means lockdown, social distancing, tests, isolation, contact tracing, quarantine, and are not to be kept below one as best as possible. I think opening up in consultation with epidemiologists and scientists is probably has got its own value. For example, Angela Merkel is a physicist. She is a scientist. South Korea's vice president is an epidemiologist, and both countries have done very, very well. Anyway, wet markets should be banned. Mask, that I suppose we'll have to continue using for quite some time. Get used to wear the mask. Health workers must use N95. Patients must wear it because so that to save others. Those who have to be near other people, like hairdressers and other people, they need to wear the mask. And those who cannot keep the social distancing as best as they can, for example, the policeman. The corona is not going to go away. Treatment, we need to have a specific treatment and a vaccine, which will be probably in about a year's time, no earlier. The treatment that they're trying now are convalescent blood plasma, which is antibodies produced in the patient transferred to a sick person. Otherwise, it's test, and do the antibody test so that we understand the prevalence of the infection. We think that only those who are ill are the patients. No, everyone, a good 50% of the population will have infection. Good 50% of that will not have any symptoms. They will be either asymptomatic or pre-symptomatic. And those are two different things. I'll explain to you in a different video. Randomized controlled trials has got to be done with the antibody test and understand the spread accordingly. I'll give you an example of Malawi. Malawi is a recent situation, 20 million population, nearly 21, 449 cases and 7 deaths. They haven't got any facility at all, come to think of it. That's what they are saying. They are expecting 85% people getting infected and almost 50,000 probably minimum and 100,000 deaths in one country of 22 million. Herd immunity is what they've chosen, and it's because of the very little facility. They say there's no point in flattening the curve and social distancing. Yes, certainly, but no situation that will help in lockdown. Talking fatalistic, in fact, depending on the nature course. Funerals are their large, they were large funerals. Like in Bangladesh, we saw a funeral of Maulana Zubair Ahmad Ansari last week. 100,000 people came up, and I'll probably show you a picture as well. Weak links that we have got are where so many people are together, like Diamond Princess Cruise, like nursing homes, like cruise ships, like prisons. Like present example is the Theodore Roosevelt aircraft carrier, which is in Guam now. There are 672 soldiers are positive. They're young people. 8 are hospitalized, and the one is dead. Well, I suppose with that situation, I suppose we need we need to think our reminders again. Stop the spread. Keep 6 feet distance. Wash hands. Use masks. Don't touch anything. Stay home. Stay safe. Stay alive. And let's think that this will pass soon. It has already started passing away, and hopefully it will go away very, very soon. Good luck. Best wishes, and see you soon.